Welcome back. We're almost to October, just one day away, and we all know that October means Breast Cancer Awareness Month. And right now we have Shelley Dusick with the Breast and Cervical Cancer Program in West Virginia. Kind of describe your role in the state and what it brings to women in our area.
So the West Virginia Breast and Cervical Cancer Screening Program has been around for about 20 years in West Virginia. We were one of the first states nationally to have the program, and our program provides free or low-cost breast and cervical cancer screening for women ages 25 to 64. You have to be a West Virginia resident, and there are some income guidelines to meet those qualifications, but a family of four can make $64,000 and still qualify for help. So just about everyone.
It's nice to know that West Virginia was maybe the first in getting this up and going and finding it so important. What would our state look like without this program?
It would be really scary not having this program in place, because there was a time before the Affordable Care Act when screening had to be covered at 100%, when your insurance didn't necessarily have to pay for screening, and we screened about 18,000 people per year.
That's awesome.
Now that that's covered, we don't pay as much for screenings unless a woman is uninsured, but we do see a lot of women who are underinsured throughout the state still. And that could be like you or I who has insurance. Right. Our mammogram's covered at 100%, but say I need a diagnostic mammogram. Suddenly I have a copay and deductible, and for a lot of women that can be a barrier to getting those tests. So we can help out in those situations too.
Let's talk about that barrier, because why is breast cancer awareness so important? If women feel there is a barrier in getting treatment, what does their life look like if they have an issue?
Well, cancer doesn't take any prisoners, unfortunately, and that goes for all cancer sites. But with breast cancer, a woman has a 1 in 8 chance of getting breast cancer in her lifetime. And in West Virginia, it's the most commonly diagnosed cancer in West Virginia women. So that's an incredibly scary statistic.
It is.
Without a program like ours, some of those barriers of affordability would just keep people out of the offices, but we're able to help people overcome that, and we're doing that in different ways. Having the resource available is one way we do it. Our community clinic interventionists actually work with clinics to do systems changes to help women that are going in to the doctor get their services. And then I work with employers throughout the state to help them develop sustainable changes, policy, systems, or environmental changes to help their workforce become screened.
It sounds like the program itself was ahead of its time in West Virginia anyway, and we're so glad that it continues to improve and expand, and we're going to learn more about the program all week long. We're just getting started, but for right now you can find more about Shelley and the Breast Cancer and Cervical Program on our website, WBOY.com. We'll have more throughout the week. Dylan joins us next with a check on our forecast.